You guys better subscribe because this content's getting better and better. So today we're talking about step one concept of collateral circulation and susceptibility to ischemia. So 65-year-old woman has a history of hypertension and AFib. And we'll read the question first. If embolization were to occur in a different organ, what would be the least likely to develop an infarction? So immediately we should be thinking of the liver. Why? Because it has that dual supply. And we'll talk about that in a second. But now let's read the rest of the stem. Hypertension here. Irregular heartbeat, non-contrast CT does not show any acute hemorrhaging, and she's diagnosed with an ischemic stroke. So yes, the answer is liver. We see it here. Brain, super susceptible. This is the spleen, super susceptible, kidney, super susceptible, and myocardium as well. Minimal collateral circulation. There's the circle of Willis in the brain, but we'll talk about that in a second. So liver. So the liver is super resistant because of dual blood supply. It's got the hepatic artery, which delivers oxygenated blood. So you get that oxygen in the hepatic artery, and then the vein also, which gets it from the GI tract. So let's look at the picture. So here's our nice little liver. And so we have the GI tract, and it's going to give us this nice nutrient-rich blood, and also the hepatic artery, which gives this nice blood, because the liver is going to filter out all this blood. And then the hepatic vein is where it spits out. But this dual supply makes it resistant to that damage of lack of blood flow. So the ischemic damage is super going to be resistant in the liver. Very important. So hepatic infarction can occur in special cases, as in liver transplantation, where the hepatic artery is the sole source to the biliary tree, so just this guy. But yeah, it has these dual supplies through the GI tract. Spleen, highly susceptible. Check this out. This is the spleen, my guys. Okay. So the spleen, splenic artery, that's an end artery here. So end arterial blood supply from the splenic artery. That's all you got. You cut this out, and that's not good. You don't have a lot of collateral circulation. So yeah, celiac goes to the spleen, and then the left gastric is up above here on this trunk as well, the common hepatic. So you got to remember these, the common hepatic off the celiac trunk, and also the splenic and the left gastric. All right, left hand side is how you remember that. Left gastric, hand, hepatic, side, splenic. Okay, so the splenic super susceptible to ischemia. The brain extremely vulnerable because you have the circle of Willis and those watershed zones that do have some collateral circulation, like the internal capsule led by these lenticular striate arteries, and I'll give you a picture of that. So here's you do have some watershed moments in the brain, the circle of Willis, where you're resistant to ischemia due to collateral, but not much. Okay, so it's super susceptible, so not that. Kidney, super susceptible, flank pain, hematuria, and myocardium also has a limited circulation, so acute embolytic events cause MIs. Like you think about myocardial infarctions all the time. Organs with end arterial supply as the brain, kidney, and spleen, they're super vulnerable to it. Okay, so that's all we need to know. But now let's talk about this strategically for step one kind of prep strategy here. So you always think of your predictions firsthand. So anytime you think of an ischemia, what's resistant to ischemia, think the liver because the dual blood supplies. Think of collateral arteries. And then you can go eliminating. What would I not think it is? Spleen, definitely not. Brain, you always have problems there. Kidney, not don't have a lot of collateral circulation. You do have collateral circulation, like the top of your humerus here. You got several different parts of your body that are known for like collateral circulation. And if those are cut off, like if you have the cut off anastomosis here, then you get like necrotizing problems. And so you just need to think about collateral blood flow circulation here, just like dumbing this down. That's the concept that's being tested right now. And then we also have to keep note of who this is, 65-year-old woman, and also her main complaints. So what's her chief complaints is history of hypertension, and I guess it just has just hypertension and problems with blood flow. And usually there's like a chief complaints, like I have this problem, and so help me with this. So keep note of that. And then also what's normal. Very important to keep track of what's normal. So here, no acute hemorrhaging, and she does have an ischemic stroke, but this is normal that they give us. Irregular heartbeat, so that tells us it's also a blood flow problem. But other normals, we don't see too many normals. They just kind of tell us, fortunately, a lot of this other stuff. Left-sided weakness and difficulty speaking is a huge complaint that she has. So normals. No acute hemorrhaging, so you're not actively bleeding out. That's important. It tells us it's not like some acute hemorrhage, like adrenal hemorrhage or some retroperitoneal hemorrhaging. It's just going to be what is the problem, what's most susceptible to the which organ is most susceptible to a lack of its vascular supply. So this is a pretty kind of easy question, but I'm just also at the end going to throw in some strategies so we can start to dumb down this test so it doesn't seem so crazy hard, and you can start to sharpen your clinical skills, and myself included. So hopefully this is helpful. If it was, like and subscribe. If this wasn't helpful, let me know in the comments what I can do to improve these videos. I definitely want to only make videos that are helpful. So please blast me in the comment section. Send the dislikes if you don't like it. Send the likes if you do. Just let me know. Give me feedback. I'd love to see it.